To date, over 35 million lives have been lost to AIDS, with a similar number currently living with the virus. Despite major advancements in treatment, infection and death rates remain alarmingly high. Joining us to discuss the ongoing fight against AIDS is Dr. Tawana Philpott Brown, Program Director for Roper St. Francis Health Services Center. Dr. Brown, thank you for being here with us today. And can you give us an overview of AIDS in today's world, and especially in South Carolina?
So here in South Carolina, over 15,000 of your neighbors and friends are living with HIV. South Carolina still rates in the top 10 in the southern states for new incidents of HIV cases. Most of those cases are in young people and African American people.
Okay, and now when you're talking about young people specifically, why is that? Why are we seeing the infection rates so high among people, what, 18 to 24?
18 to 25. Okay. I think it's a couple of reasons. I think that they don't think that it can affect them. I think that sex is still a taboo subject to talk about. And then most people don't like to talk about prevention in the bedroom. So I'm like, that you can make it sexy. Yeah. You can talk about it before you even get in there. Yeah. You know, how many life partners have you had? When was your last HIV test? When was your last STD screen? I have all these different flavored condoms. I mean, we can make it sexy, but I think those are sometimes hard conversations for people to have.
And it disproportionately affects the African American community.
Correct.
Do you think it's an issue with accessibility to treatment, or like you said with the youth, it's the conversations that we're not having?
I think it does, well, that's a longer conversation, Taylor, but I think accessibility is an issue. I think when we look at disproportionate access to care, that's an issue. When we look at our rural communities that have little to no access to care, that is an issue. When we look at poor communities that don't maybe have insurance and they think they need insurance to come to the doctor. In some cases they do, but in our case you do not, to come see us. I think that's an issue as well. So it's a lot of determining factors. You have to have me on longer to talk about those.
Yes. And this is good. Having these conversations are so important because this is, you know, it's a conversation that needs to happen more often.
Absolutely.
And National Latinx AIDS Awareness Day is coming up. It's on October 15th. And I want you to talk about, Dr. Brown, the research breakthroughs. I've been hearing a lot about this PrEP. Tell me about it. Is there anything new that's going to be hitting the market soon?
So excited about PrEP because we know that if you are undetectable, for one, if you're in HIV care and you're undetectable, you cannot transmit the virus to another partner, right? And also if you're on PrEP, you can protect yourself from getting HIV, which is very exciting. The first PrEP drug that came out was like Truvada, and you have to take it every day. Now it's some new breaking research on the market where it's going to be a PrEP injectable drug twice a year.
Oh my goodness.
I'm so excited.
Okay, and that really is like moving the needle forward with the treatment options for HIV, but now PrEP, it just prevents you from getting it, right?
Absolutely.
And now what are some options for people who are going currently through treatment, who have HIV or AIDS? How are they, what is the market looking like now for that?
So many different options. When I first started HIV care almost 20 years ago, there was only one pill regimen available to you, and that was a triplet. It was kind of hard to tolerate. Now there are over 4 or 5 one-pill regimens available to you versus taking the 24-pill cocktail that they did back in the 80s. So HIV treatment now is very tolerable versus how it was, you know, back when HIV first came around.
Yeah, and it's exciting to see. I mean, I wonder in 20 years what this is going to look like. It's exciting, these advancements.
Hopefully in 20 years we'll have a cure.
Yeah. Yep, and also a way that we can help is going to events and galas. So tell me about what's happening this Friday.
So, you know, we are a nonprofit organization, and so we fundraise and we have grant funds for our program because people can come to us free or to low cost. You do not have to have insurance to come and see us, so we love that about our program. But we are having this gala on Friday. It's our Paint the Town Red. It's our 2nd annual gala, and we'll be doing a silent auction. We'll be doing a live art auction. It's all you can eat, all you can drink. We want you to have your best threads on, your best makeup. We're going to have red carpet, 360 booth. We have the band. It's going to be a great event.
That sounds like a great event. It sounds like it's going to be fun.
Yeah, party with a purpose.
Party with a purpose. And now where can we get tickets?
So you can get tickets on Eventbrite. You can also Google Eventbrite, Paint the Town Red. It'll come right up. Or you can go to our website at rsfhealthservicescenter.com. HIVTickets.com.
Wonderful.
And we'll get tickets there.
Perfect. And we'll put that website down below for you all. Dr. Brown, I want to thank you so much for joining us today and having this important conversation.
Thank you for having me, Taylor.
We're back after this.